you okay? Okay, don't worry, the nurses are coming.
Hello, Miss Anderson. Miss Anderson, are you okay?
Nadia.
Mom, we're here. We're at the hospital, remember? You fell?
Miss Anderson, can you tell me where you're at?
Hospital.
Can you tell me your full name? Miss Anderson, do you have any pain? Okay. Okay. I'm going to take your vital signs and the nurse is going to be talking to your daughter, okay?
Signs and symptoms include change in level of consciousness, sudden severe headache, photophobia, lower back pain, nausea and vomiting, motor weakness, and stiff neck.
Hi, Miss Nadia. How are you today?
Hi, good. I'm just so worried about my mom.
What happened?
Well, basically, I found her on the floor in her room. I heard a thump. I was in my room. I ran, and she was just on the floor, and she was unconscious. I was trying to get her up, and I just couldn't, so I just called 911.
Okay, so what time did this happen?
This happened right now, just like 10
right
minutes
now.
ago.
Okay, did she show any signs of she was about to faint or anything?
No, I mean, she didn't say anything. She just fell.
Okay, does she have any past health history of anything?
I mean, well, she does have hypertension, and she does have diabetes as well. I mean, she did complain of headaches, so I remember that.
Headaches.
This morning, she was complaining of a headache.
Got you. Okay, headaches. Okay, so we're going to do a little quick assessment on your mom.
Oh, and I forgot. I brought her medication list, okay? And it has the date, the times, and the last time she took it as well, okay?
Okay, I'm going ahead and go chart this, and I'm going to give it to the doctor, okay?
Okay, thank you.
Miss Anderson. Okay, Miss Anderson. My name is Chastity. I'm going to take your vital signs, okay?
Chastity?
Yes, my name is Chastity. Okay, I'm going to take your vital signs. I'm going to have you lift your arm a little bit. Okay.
Nadia? Mom, I'm right here. She's just taking your vital signs real quick, okay? So just hang in there. She's taking your vital signs.
Nadia.
I'm right here, Mom. I'm right here.
The patient presented with the following vital signs: an oral temperature of 97 degrees Fahrenheit, pulse of 85 beats per minute, 18 respirations per minute, saturated oxygen of 96%, and a blood pressure of 187/90.
Hello, Miss Anderson. I'm Dr. Benjamin. Go ahead and just check you right quick. Let's see what's going on with you.
It's okay, Mom. It's the doctor. He's just going to check you real quick, okay? It's all right. What's going on, doctor? Is my mom okay?
She's fine. She's getting better. She'll be fine. Open your eyes.
Upon assessment, patient's skin is flaky, dry, and warm to touch, with the color being normal. Patient is alert, needs assistance with activity, speech is clear and oriented ×2 person in place. Responds to commands and responds to pain. Pupils are unequal. Patient is blind in right eye. Movement of upper extremities are limited on the right due to right-sided weakness. Patient's heart rhythm is regular. Radial pulses are normal bilaterally. Pedal pulses are thready bilaterally. Capillary refill is less than 3 seconds and sensation is present. Respirations are unlabored and breath sounds are clear. Abdomen is soft with bowel sounds present in all 4 quadrants. Urine is yellow. Patient has accepted his diagnosis and is cooperative.
Oh, you are the daughter, right?
Yes. My name
Okay.
is Nadia, and I'm her daughter.
Okay, I'll go ahead and prescribe aprosolene for her, so that we'll start from there. Then we we order for CT scan, okay?
What is that? What is that?
That's high blood pressure medicine so that the blood pressure will go down.
Oh, okay.
Will come down.
Okay.
So,
yes.
so that we'll get it from there, okay?
Okay.
All right. Thank
Okay,
you.
Mom? They're going to give you medications, okay, Mom?
Miss Anderson? Okay. I'll see you later, okay?
Diagnostic tests include CT scan, which reveals subarachnoid hemorrhage, examination of cerebral spinal fluid, which confirms bleeding, ECG, which reveals bradycardia, atrioventricular blocks, CBC, which will show an elevated white blood cell count, cerebral arteriogram, which will show the presence of cerebral aneurysm, and MRI, that is performed when no lesion is found on an angiography.
Hello, Ms. Anderson.
Hello.
Hi, my name is Latifa. Can I see your handbag, please? Can you see your name, your full name? Bernice. Bernice who?
Anderson.
Anderson.
Yes.
Okay. Okay, I'll be giving you your adrenaline, and this is used to lower your blood pressure, okay? Okay, I'm going to give you. Oh, this is a nice IV spot. Did they put this
Yes,
in the hospital to the EMS?
Yes, in the EMS.
Okay. Stay still, Miss Anderson. You'll be alright.
Okay, look, Mom, you're going to feel so much better, okay?
Okay.
Your blood pressure's going to go down, okay? It's okay. I'm here for you, okay?
Okay. And then just relax, okay? I'll be back in the next 15 minutes to reassess you and see how your blood pressure is, okay? And every 15 minutes we'll be coming in to do your neuro assessment, okay? Is there anything else?
No, that's all. Thank you.
All right.
Pathophysiology of subarachnoid hemorrhage. It occurs when there is an intracranial bleeding into the cerebral spinal fluid filled space between the arachnoid and pia mater membranes on the surface of the brain. It is commonly caused by a rupture of a cerebral aneurysm, and it can also be caused by head trauma.
I'm back with your results, CT scan result. You have a subarachnoid hemorrhage. So, no, you don't panic. It's just a little rupture on the brain. So, but it's gonna heal by itself.
So it was a small then?
It's just a little, so it's gonna heal by itself.
But who are you?
I'm the doctor, Dr. Bain.
Mom, remember?
I came earlier and checked on you and do some examination on you. So I came back with your result. So with the medication, so I'm gonna communicate. Yes. So I'm gonna communicate with the nurse. Then I'll give some orders so that we'll work on you by the medication I'm gonna order. Okay?
Okay. So what did you say was called?
Subarachnoid
hemorrhage. Okay,
yes.
So that's in the head, right?
Yes.
Okay.
She fell, and due to the way she fell, yeah, so she had the problem, so that was the problem. So, but it wasn't too bad. So we're gonna buy medication, so everything will be all right.
Okay, so it's gonna heal itself. Is that what you're saying?
Yes, that's what I'm saying.
Okay, see, Mom, that's good news. It's gonna heal itself. You're not gonna need surgery.
Okay, Miss Anderson?
Yes.
Okay, I'm gonna see you again, okay? All right, bye-bye.
Treatment will include bed rest, surgical repair like clipping, ligation, or wrapping, antihypertensive agents, anticonvulsants, hydralazine, and calcium channel blockers. Complications of subarachnoid hemorrhage include rebleeding before surgery or other therapy is initiating, leading to cerebral infarction, seizures, cardiac dysfunction, hydrocephalus, and cerebral vasospasm.
Hello.
My name is Yesenia, and I'm one of the nurses here. What is your name?
Hi, my name is Nadia.
Okay, and then you're Miss Anderson?
Yeah, she's my mom.
Okay.
Hello, Miss Anderson. My name is Latifa, and I'm one of the nurses here too.
We're going to be doing your patient teaching since you're going to be going home, okay?
Oh, look, Mom, they're going to teach you some stuff. Good, yeah. Because her hypertension and her diabetes is just, she doesn't know how to manage it. So.
Okay. Regarding your hypertension, we do want to go ahead and do some lifestyle modifications. For example, if you do have a lot of fried foods, we prefer you bake your food instead. That would be really good.
No more fried chicken, Mama.
Also, we also recommend exercise at least 3 times a week. It doesn't have to be anything vigorous. And just, at your own pace. Another thing is we need you to do a low sodium diet. That can be a little difficult at times, but it will help you in the end, okay? Also, we recommend that you monitor your blood pressure daily and record it. Do it in a quiet, you know, nothing spontaneous environment. That way you can record it, and then whenever you come in for your other appointment with your doctor, you can share those records with him, okay? And also continue your medication. Do not stop your medication, okay?
So do we have to buy one of those things for
a blood pressure cuff? Yes, you can find one at Walgreens, or they even have the machine that you can just go and do it yourself, okay? Ms. Anderson, another thing I wanted to talk to you about is signs and symptoms of a stroke. You know, it can happen. You just need to be aware of those symptoms, okay? We have an acronym that we use. It's FAST. It's mainly for your face, arms, speech, and time. For your face, they're going to ask you to do if you can smile. And then for your arms, if they are weak or limp. And your speech, if you're slurred, okay? If your speech is slurred, and also you need to call 911. That's for the time. You need to call 911 as soon as you feel these symptoms coming on, okay?
Yeah, I was concerned about that. Okay, and with your diabetes, we need your mom to try to lose some weight, you know?
lose some weight?
Yes, she just has to lose a little bit.
Well, probably if she's on that diet she was talking about, maybe that would help.
Yeah, with the diet modification,
yes.
this is really going to help, probably, you know. So, and again, she needs to monitor her blood glucose every day.
Oh my, she doesn't like the sticking, but...
No, she can do it on the side of her finger. You don't really have to do it by the tip, just on the side. That's less painful.
You heard that, Mom? So we're going to do it on the side, so it'll be less painful, okay?
Okay, Miss Anderson, you have some pamphlets for you to see?
Yes, I will. Okay.
Oh, so these are the kind of foods you have to eat now, okay? A lot of veggies, no fried food. You need to exercise, and this is going to be good for you, okay? And here we have the list of all your medications. I would implore you to use your medication at the right time, okay? Do not skip a dose, okay? So you're gonna feel better. We have to lower your blood sugar so you don't feel dizzy or unconscious, okay? Make sure you use your medication at the right time, just as she said, okay?
My daughter takes care.
Oh, that's good. So
I have it written all down, so.
Okay, I will leave you this with her so you can take this.
Thank you so much. Thank you.
It's very important for you to know these signs and symptoms so we can get you in and taken care of as soon as possible, okay? If y'all have any more questions, let us know. If y'all need any more information, let us know as well.
She gave us a whole bunch of pamphlets, so I think.
Yeah, this is the one for the stroke symptoms.
Oh,
you have
okay.
to have that and take it home and just always be aware of it, okay?
Okay, thank you. We're going to post it in her room.
Sounds good.
Bless y'all.
You take care, Miss Anderson. We don't want to see you back, okay?
I don't want to come back.
Make sure you take your medications.
Y'all did a good job.
Thank you so much.
Because our patient has right-sided weakness and is blind from his right eye, we felt his activity level and safety was a priority. Activity intolerance related to impaired physical mobility as manifested by right leg weakness, right side eye blindness, diminished mental status. The goals and outcome criteria we chose was to the patient's activity level to increase. The interventions include assess heart rate, blood pressure, and respiratory rate before and after activity. Assist with activities as needed and encourage the patient to prioritize activities. Encourage the patient to alternate periods of activity with periods of rest. Monitor response to activity, including pulse, respiratory rate, oxygen saturation, and dyspnea. Instruct the patient to stop any activity that causes shortness of breath, chest pain, or dizziness. If shortness of breath occurs, administer oxygen as ordered, and encourage the patient to sleep 8 to 10 hours a night. For evaluation, the goal was partially met by the end of the shift, but the patient still reported weakness, and we assisted the patient during care. However, he refused his medications.
So because our patient has a wound vac as well as a stage 2 pressure ulcer, we want to make sure to assess his skin. We want to make sure to turn the patient every 2 hours to relieve pressure of bony prominences. We want to avoid shearing. We want to assess the patient's nutritional status. We want to keep the skin dry and clean. And we want to assess the wound vac for any drainage. Since the patient's ulcer is in the sacral area, we want to assess for fecal and urinary incontinence. We want to teach the patient about the importance of adequate nutrition and hydration to help maintain skin turgor. At the end of our shift, the goal was met. The patient's ulcer dressing was changed and there was no purulent drainage present. And the patient's wound vac was changed and there was no presence of drainage. Since our patient is diagnosed with diabetes mellitus, we want to make sure to monitor blood glucose levels. We want to make sure to assess for signs of hyperglycemia or hypoglycemia. We want to assess any medications taken regularly because some medication can cause fluctuations in blood glucose as a side effect. We want to assess the pattern of physical activity. We want to assess his eating and knowledge of the diet. And we want to make sure we administer his insulin medication. We want to make sure to teach this patient the importance of taking their insulin medication. However, by the end of the shift, the goal was not met because the patient refused to take his insulin or any other medication. So by the end of shift, patient's blood glucose level was 268 mg/dL. However, the nurse did contact the patient's daughter to come visit and encourage the patient to take his medications.